Have a feel of that femoral artery. Feel it? Like that. Mm-hmm. Yeah? Now feel that side, where you were the surface marking girl, weren't you? Okay. And this is his bad leg, where his symptoms are worse. Now the first thing you need to be a surgeon is complete and absolute honesty.
Can't be everything.
You come to me a piece of wet clay, but in 3 years I shall mould you into something beautiful. Because you've got that streak of honesty about you, which is what I'm looking for in a young surgeon. Yes, you can't feel it at all. You see, if you were going to be a physician, you'd say, I think I can just feel it. If you were a psychiatrist, you'd say, oh, yes, definitely. Definitely.
Mr. Adamson, are you all right? Yes. What have we got for you? Before lunch, salbutamol, which he's had.
Mr. Montrese, would you like a cup of tea?
Tempeh, I would like pink
Cold milk?
What disaster did I order?
Well, they won't be very specialist. They can get in contact with the specialists.
Mrs. Wallace, please. Hello. Can I just have a check your address?
Shaw? No, Shaw, this side. Yeah.
Other side.
Other side.
I think it's the side room, actually.
The side room. Okay.
Westminster Medical School in London's Horseferry Road has been training doctors for 150 years, and it's thought to be one of the very best. But both the school and the hospital to which it's attached are threatened with closure. The problem, predictably, is money, and a final decision is expected next month. In this film, we look at what might go. The making of a doctor, Westminster style.
Mr. Davis, how long have you wished to be a doctor? First thing.
Now, that goes back to about the third year when I had to decide what job I wanted to do and what O-levels to choose. And I thought the best way of doing that is to do it very systematically and take a piece of paper and write down the criteria that I wanted my job to fill. And there were several, really. The first one was that it had to be a secure job. The second one was that it had to have a lot of variety. And the third one was that it must have just a little bit of social status, because, I mean, you know, if you do spend a long time getting your qualifications, I think you deserve to be recognised for it.
Thanks, Mr. Davis. Mr. Forrest, what is it that you particularly like about your organ playing? Is it the big noise?
Not really. It's such a flexible instrument, and there's such a wide variety of music for it. You can get all sorts of very early music, which is written for very early organs, which were quite simple. You know, some of them didn't have a pedal.
Manual only, yes.
Yes, and a few stops.
Have you had any other interviews elsewhere?
Yes, I had one at Oxford, and it was a totally different cup of tea from this interview, completely. It was a very aggressive one, and the moment I stepped in the door, I was completely grilled from head to toe. To put it mildly, I didn't really make a great success of it, but I'm not really too bothered, because I think, without hoping not to offend anybody, I think Oxford does breed some very eccentric people.
Do you know what you're in for, then, for the next 5 years?
I've heard rumblings, some of them quite humorous, but I'm willing to work hard, and I'm willing to devote myself to my studies, and if that's sufficient, then I think I can get through.
Good. Well, thank you very much for coming to see us, and we'll be in touch.
Actually, it will be very exciting. It's a very exciting time when you start the technical work. I just think you can hardly wait to get over it. It's like being the first time on the floor. It'll break you all in when you come in. first chap over here is completely gaga. He's a very severe, he doesn't understand anything, he's a very severe head injury following a road traffic accident. Completely gaga, lives on a drip, catheter in his back. Hello, friend, I'm just bringing these doctors along to have a look at you. Look, some of you come round this side, and some of you come round. Wear a helmet. Mr. Dowling. Just show the doctors where you're getting the pain in your leg when you're walking.
Well, it starts in the foot and
For a new medical student, meeting patients, the flesh and blood cases on which they'll be taught, is very exciting. After 2 years of theory, this is the real thing. In the next 3 years, they'll acquire a variety of skills, technical, emotional and professional. It comes from watching, listening and endlessly trailing in the footsteps of their eminent masters.
And what sort of a pain is it when you get it?
well, it's like a sort of cramp.
Do you know what that pain's called? Intermittent claudication. You're a classical scholar. Who was the Emperor Claudius? That's your question. What does claudicare mean?
No idea. They don't know, and he says it's a test for glandular fever. He's right. It's called a heterophil antibody test. And I think that we will ask Mr. Roth this afternoon to tell us about the Paul Bonnell test, how it is done, its significance, whether Paul Bonnell was one man.
Glad this doesn't occur every day. Ah, good morning. I mean, why have I got fat chubby hands and he's got these wasted hands? I guess my strength would be more than his, you see. But you tell me why some old people get wasting of the small muscles of the hand and some don't. Speak up. You don't know. This is applying anatomy.
Now, you're a good physiologist. What gives the skin its normal colour?
Well, the dilation of the arterioles.
Arterial blood going through capillaries.
Yes.
So when my hand goes white, it's because the arterioles are constricted or empty. When my hand goes blue, what's the significance of cyanosis in physiological terms?
Not enough oxygen to the tissue.
Pish tosh, tish tosh. You haven't done any work. What's cyanosis in physiological terms? What does that mean?
No way. What? Is he still bleeding, Cliff?
Funny, all junior students make the same mistake. You've obviously never been a drummer. You all have this business. You go bonk and then you go bong and leave your finger on it so that it doesn't resonate. And it's there, and then you get... I'm not hurting. Come on.
Is this the final exam?
No, this is under the tests that we're doing at the moment.
One of the tests?
Right. Thank you, sister dear. Well, that's all right. Nice. Ah, right. Now, how are you?
Mr. Gaffour, please. Mr. Gaffour, please. Now, Mr. Gafour was complaining of some trouble suggestive of the right kidney. He also had a peptic ulcer, and he's a specialist in Bangladeshi curries, and I believe enjoys eating your own curries. We think, of course, it's not an ideal diet for a patient with a peptic ulcer.
This is Mr. John Shevlin. He's a 63-year-old glazier. In the past, he's been a painter and decorator. He came in on the 14th of April of 1980, complaining of difficulty with swallowing. He vomits after eating, and he vomits the food, you know, not sort of digested or vile, just the food. But he can take fluid, and that goes down easily. He says that he's lost a bit of weight, you know, about 4 or 5 pounds, but his appetite is... He doesn't feel that he's lost his appetite. He feels normal appetite. He just can't take the food down.
Okay. There are several points missing from your history, I think. First of all, when somebody is dysphagic, we usually, the first question we ask is whether it's the initiation of swallowing which is difficult, or having swallowed, does he then feel the food stick? Did you follow the question? You can swallow all right, and then it's difficult, or it's difficult from the word go when you put it in your mouth?
It's not difficult from the word going in the mouth. It goes down a certain way and then stops.
And then sticks. How long does it take to start after you swallow?
Oh, about a minute or two.
Sure, okay. I'll come and talk to you later, okay?
That's fine, thank you.
Come on, let's just go and sit in here now. Yeah, no, that gentleman knows a diagnosis. I've had a talk to him about it, but I still think it's probably best not to discuss it out of there in front of him. On Wednesday morning, I see him, and he says to me, "It's cancer, isn't it, Doctor?" What sort of reply are we going to give up to that, Mr. Stewart?
Well, if he's looking for the answer, I think you have to tell him if he's in a fit state to take it. If you think psychologically.
And how would you assess whether he's in a fit state to take it or not?
Well, the very fact he's asked you the question in a way that he really wants an answer, I think.
What do you have to then go on and say?
Probably what his chances are as well, without giving you that exact figure on anything.
Yes, I think the most important thing you've got to give him then is time, really, is you tell him the news and you sit and chat to him for a few minutes, and then you say, "I will come back in an hour's time." And if you're going to say you come back in an hour's time, that's got to take priority over everything. What do you think he's almost certain to want to know? Miss Rowe?
How long he's got?
Well, I think that that's very difficult to foresay, and I prefer not to give a time limit unless I'm absolutely forced to, because nobody knows.
How much pain he'll be in?
Yes, I think that that's the sort of thing. I think that the things that you can tell him, and you should tell him straight away, are that we are going to treat him and make sure, one, that he's in no pain at any time, which there's no reason that he should be, and secondly, that we should be able to make the swallowing problem much better. I think dying from carcinoma of the esophagus can be one of the most unpleasant experiences there are. And I think this is quite wrong, and I think it's not good medicine if people ever suffer considerable amounts of pain, particularly when their lifespan is limited. I think that's all you can really do. It's a difficult problem. Okay, right. We might go and see one more patient.
Now, this is our first visit up here on the premature baby unit, but what we're going to do now is to look at this very special situation of children who are born prematurely, or children who are born and become sick almost immediately after the event. And let's gather round the first of the infants. Now, what I want you to do is to make a basic neonatal examination, just as Dr. Maters has to do as soon as the baby arrives in the ward. All right? So you are actually going to get your hands on the infant and look at the key points and demonstrate them to the group as you're doing it. Will you do that for me, please? Off you go.
Well, first of all...
First, before you do that, is do you wash your hands, isn't it? Because you've just been examining another baby. Are you still in are you in a position to start examining yet?
I'm just going to remove this.
Very good. It's putting it back on that's the problem, isn't it?
Come back, Mum.
Hello, gorgeous. You're going to sit up and bounce around. Come on, darling, how are you? Here you are. Her mum spends a great deal of time with her and does all the feeding, washing, bathing and everything, doesn't she? Hey, gorgeous? As you're a new group, I thought I would just tell you about this little girl, Amanda, who's now about 4 months old. She was born here because Mother had had a previous child that had severe combined immune deficiency. So when she was born here, she was put into an incubator in sterile conditions, and she has been in a tent like this, which you can see protects her from all bacteria from outside because of these filters here. And what one is looking for is a related family donor who's got the same tissue types, if possible, as this little soul. We've looked on the large volunteer bone marrow donor panel that we've got, and unfortunately there was nobody on that with even the same tissue types. Then Professor Hobbs tries to make a donor out of one of the parents. Unfortunately, we couldn't make a donor out of either of them. It wasn't something we could look for before the child was born. They were, given all the information after their first child's death, and they knew exactly what the score was. There was a 1 in 4 chance of it being an affected child, and it is jolly bad luck that their second child is also affected. And of course you can see she's coming along splendidly well, but of course it's putting a dreadful strain on the family. They've got a child in hospital, they're not quite sure what's going to happen. They know full well that when she comes out of here eventually she will die of infection. And here she is, looking a super little person, and it tears at your heartstrings to know what to do. But they know she can't stay in here forever, that they have accepted. But they do want us to try and get this one last attempt of doing thymus and liver from the same 12-week-old fetus.
Divinity. We'll move on to top of page 60.
I don't think there's any problem pitching it.
We'll go through it again then. 55.
Stay, we must not lose our senses. Men who stick at no offences will not long be here. Piracy, their dreadful trade is. Pray you get you hence, young ladies, while the coast is clear.
No, we must not lose our senses. If they stick at no offences, we should not be here. Piracy, their dreadful trade is. Nice companions for young ladies. Let us disapprove.
It's a first-rate opportunity to get married with impunity and indulge in the felicity of unbounded domesticity. We should quickly be personified, conjugally matrimonified, by a doctor of divinity who is located in this vicinity.
Opportunity of escaping with impunity.
Unbounded domesticity. We shall quickly be personified, conjugally matrimonified, by a doctor of divinity who is in this vicinity.
By a doctor of divinity who resides in this vicinity. By a doctor of divinity. Of divinity.
By a doctor of divinity who resides in this vicinity. By a doctor of divinity. Of divinity.
Sit forward, mate.
Little injection. Okay, open your spread it like that.
Who were you under, do you know? Have you just injected yourself with something, Chloe? What did you inject? Come on, Chloe.
I just...
What did you inject yourself with, Chloe?
Hold on, darling.
Just keep on swallowing the tube.
That's
Don't
it. Good
struggle.
lad.
That's it. It's almost finished now. Come on, just lie
Good
still
lad.
now. Don't pull
Grab
the
onto
tube
that
out. No, yeah, just lie very still.
Don't fight it, love. Penny, can you get the security chap?
Hey, Andy.
No, Andy.
Come on. Come on, Andy.
Andy, come on, mate. Sit
Relax,
down.
mate. Come on. Look, he's
Come
on
on.
the ring or what?
Look. Yeah, look.
I'm just
Listen.
trying to find out.
Mind your head. Come on, Andy.
Listen, Andy, I said we'll ring your girlfriend later on, didn't I? Yeah?
Okay.
You got assaulted, didn't you, in a pub? Yeah?
It doesn't matter.
Come on, Andy.
It doesn't matter. Can't put my sleep.
You are half asleep now, do you know that?
Yes,
you are. Now, if you just lie there, okay, and be good, this will all be over before you know it. Stay still, stay still. Try and stay still, Andy.
There we are.
Okay, Andy. Calm down, mate.
Another suture pack. Just relax.
Andy, calm down. Okay? Relax. That's the way. That's the way.
Everyone's got dirty.
It is very, very difficult to fail the exam on what you do in the viva. Where the viva becomes extremely important if, like happens to many people, you are right on the borderline. And then the viva is used to make or break. Most of the information in a pot is contained in the front view, but quite often it's advisable to look at the back. It is seldom necessary to peer down the top, and almost never necessary to peer up from underneath. Now, you have a look both in respect of size and what you see. You have a look at that specimen. Now, what is it?
I think it's a bit of lung.
It's quite a lot of lung, in fact, isn't it? But it's quite a small lung.
Yes, it's a small lung.
All right, it's a slice of a lung. Now, look at the cut surface of it rather than the back, and tell me what you can see.
Could it be miliary TB?
That's right, miliary tuberculosis. Good, that's splendid. Now, would you like to look at that? Doesn't the shape suggest an organ to you?
Breast?
I doubt it, and I think it's a very good thing that most breasts don't look like that. You're holding it quite near your own counterpart to it. 2 lobes and a middle. What's that? Thyroid. Yes, it's half a thyroid. Now, will you please describe to me in what way...
My name's Liz Higgins. I'm a medical student and I'm attached to Dr. Gomez here. And I'm just going to ask you a few questions like they did when you first came into hospital to find out about you and what's been the problem. Is that all right? It's up to you.
There isn't a problem.
There isn't a problem.
No.
Do you know why you came into hospital?
Yes. I'm not in control of my own situation.
Who do you think controls it?
I do, except for environment.
Except for environment?
Mm-hmm.
And who controls your environment?
You do.
The hospital or me personally?
You personally, when you have the women fancy to do so.
I see. How old are you now, Terry?
28.
Dear, and have you ever had a job? Are you working at the moment?
I've done many an occupation. I'm older than you, I think. How old are you?
I'm 22, so you are older than me.
Yes, and I think that you should respect your elders. That's for start-offs, before you even arrive here.
But can you tell me what sort of jobs you've done? Because it's very interesting. What have you done?
Nothing that would interest you.
Nothing. And what does your G-Dad do? Does he do anything? Do you work with him?
You're confident, aren't you?
No, no.
Well, you look confident.
Do you feel confident?
I mean, the staff here, are they fascist?
Of course they're not fascist.
Neo-fascist?
They
Then
have many different political views.
Why is it that they're always bossing people about, pushing people here and there, asking you to do this and do that, asking questions left, right and centre, acting as though there's a socialist government in power?
They ask questions because they ask questions to try and find out more about
They,
the patients.
it's not they, it's you.
What would you hope that they could do for you? What did
Help
you
me
come
make
in?
a pair of stilts, at least. I need to make a pair of stilts. That's the obsession on my mind, the so-called obsession.
What will you do if you make the pair of stilts?
Walk on the bloody things.
But why? What do
Why
you have to
shouldn't
do
I?
then? Is that to make money or to get a job?
To make money and have a job. It's my capacity. I'm a professional stilt walker.
Have you worked in circuses before?
I don't work for anybody. I work for myself.
I mean, as you know, psychiatry is a rather vague subject, and one goes on feelings a great deal. But you've got the feeling at this point that you were perhaps dealing with somebody who was trying to take a little bit of the mickey out of you.
Yes, absolutely. And he was angry with the system. I think he was angry with doctors and angry with hospitals that they couldn't give him exactly what he wanted. And he asked me at one point if I thought he was insane, and I don't think he is insane. I mean,
Did you answer?
Yes, I said I didn't think he was.
And was he relieved by that, or pleased? Or?
Yes, I think he was quite pleased.
And your own feelings, I mean, you seem to have responded emotionally very well. I mean, you that is, you didn't react as if you were talking, I mean, when he was hostile to you, you didn't react like so many people do by being hostile back. Many doctors sort of seize their patients by the neck if they're hostile, don't they? But you didn't feel like doing that.
No, I usually asked him why he felt like that.
Yes. Equally, you didn't feel like embracing him.
No.
No. Well, Liz, you'll make a good psychiatrist.
Oh, I'm not sure.
Hi, good afternoon, Mrs. Oldman. I'm Paul Cundy, a medical student. I'm going to be delivering you this afternoon.
Yes.
I understand you've had several babies before.
Yes, I have.
That's right. Any problems with them in the past?
Yes, with all of them, they've all, well, except for the first one, they've all had this rhesus factor.
Yes, well, I think we've got that under control.
Yes, this is all right, this one, it
So
seems.
You know about all the breathing and the pushing and when to push?
I should do, yes, hopefully.
Right, well, I hope I won't have to tell you too much then. We'll be expecting you sometime this afternoon.
Going now?
You've got a son already, have you? You want a daughter this time? Any names ready?
Madeline, it was a girl. Benjamin, it was a boy.
It's 3 minutes now, and they're lasting for 2 minutes.
Oh.
We've got one coming on now, actually.
Yes, I did it.
It's reached its peak now. That's relaxing.
It's just moving away now.
Won't be long now, then.
Mrs. Fairmeyer is progressing very well. She's in the second stage of labour now, and we can just see the baby's head, so this is the time to start scrubbing up and get ready for the delivery. Just do your breathing, Mrs. Fairmeyer. Just take deep breaths in and out. And when the contraction goes, just relax completely.
That's the way. Super.
That she's doing very well, which Mrs. Fairmire is doing extremely well.
So take the blanket away now. Out of the way.
With the next contraction, you can bear down for me, and we'll teach you how to do that. Put a sterile pad to cover the anus, and we can see the perineum very clearly. Now, you can take a deep breath behind your thighs, you see?
Under there,
That's right. Behind your knees, legs apart, and deep breath, lips together, and push right down into your bottom.
Push.
Push hard, long.
More.
It's important that one person tells the patient what to do, otherwise she'll get confused. Longer, longer. Keep pushing. That's very good. And another breath, hold it, and push before the contraction goes. That's very good. Okay. Shall we just, I want to sit up a bit, have shoulders on under the pillow. Is that another contraction? Stopness, that's another contraction. Hands behind your thighs again. We almost have baby's head with that one. And a deep breath, lips together, and push right down into your bottom. Push. That's very good indeed. Longer, 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 longer than that. Longer, longer. Yeah, you can see the perineum is stretching back. Take a deep breath, fill your lungs, hold it, and push hard again. Longer, 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 longer than that. Longer, longer. Keep pushing. Go on. Longer than that. Longer. Oh, that's very good indeed. And once more before the contraction goes, and go on. And push, go on, longer, 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 sweetie, longer. That's very good indeed. Now, nice slow delivery of the shoulders and body to prevent a postpartum hemorrhage. And that's the correct position. Do you want him to do it? Yes, we'll do it together. It's a little boy, how wonderful. Now, you clamp and cut the cord, 2 clamps firmly on, and cut between.
A little bit of muck is falling out.
Shall I turn the baby the other way? Wait, just take it out. To prevent the... Yes, and you use the cord scissors. Lovely.
He's using Madeline.
Well, that was a pretty good piece of work, wasn't it? On the third day, I know.
Yes, it's a pretty good. That's a good record.
I'm very proud of you.
Now, the story is he was brought in by his own doctor, who said he'd been previously quite well, and then suddenly threw a fit. Grand mal fits for the first time, and he was fitting on and off for about an hour. Well, now, Dr. Bending, an experienced chap, saw him when he came in. He found that he was comatose, with his eyes fixing, no response to command, little response to pain, and that his left arm and leg were flaccid. So he was admitted to the ward, where he, let me just look through his notes, became agitated and confused in the ward, having recovered consciousness. He was moving both arms, pulled off his oxygen mask, slipped out of bed, clutching at his right temple. And later he became conscious enough to say, yes, he did have some pain and clutched his right temple. There was pain. So this boy has been through the wars, and we'll see that he's been through other wars as well. Come and have a look at him now. Come and step beyond the stand. He's almost of the generation that fought the Kaiser, the moustache of that period, and some decorations which suggest perhaps he was active, I don't know, was that Colonel Cody or Charles I? I'm not quite sure. Now, what can we tell about him? You're going to be in casualty, you know nothing about him, but just looking at him from top to toe, what can you guess of his background? We've seen one thing, that he's an old soldier, so that's one thing. I don't know if this has been the fate of any of you. I've got a rather depressed knuckle over here and a lump in the mid-metacarpal. What's that? Probably a break. He's been fighting, hasn't he? But perhaps in the cause of duty. Let's look at his eyes. We can see small pupils. They're irregular. You can see that he has had cataracts. You know, the iris is no longer round. It's often eccentric. Now, what else can we tell about him? He's pretty thin, isn't he? He's been living on his own, so he hasn't been exactly been fed. You can see how thin this is. We shall no doubt hit adhesions from his previous operation. Now, I'm sorry for our friends here who are not used to these things. God knows you're not at this stage. What's happened? There's been a perforation, hasn't there? Indeed, we've got fecal peritonitis. Well, it's one of the hazards, isn't it? And I must be careful to do this neatly. Jim, could I have some saline and a sponge, please, now? We shall need it to make things a bit more respectable. I shall note the presence of flies in future and wonder if that's a good sign of what's inside. And I think I might do better to divert to something rather less unsavoury. Whoops, gone through. Very, very thin chap here. Now we'll just open the chest. We'll do this sternoclavicular joint there. Any luck, I can run down here. Excuse me, can I just pinch some instruments? That's all right. Just cut up the costal cartilages and see what we find inside. We know this man to have had TB. Now that's a real fear for me here. Somebody's shifting nervously there, because it's this age group which is subject to tuberculosis. They had it in their youth, through poor circumstances, declining immunity of age. That TB may light up again. Yes, and the first costal cartilage becomes calcified as we get older. It's no shame on you, therefore, if you, when you do your first cardiac massage, if it's somebody over the age of 40, you're almost certain to break some ribs. Now, I'll nip round and get the neck organs free. We must look carefully at the carotid
pelvic examination. When you perform a pelvic examination, you're performing an examination which to most people, both at the receiving end and those who are performing it for the first few times, is going to be rather more awkward and sometimes a little embarrassing and sometimes a little difficult than most of the forms of physical examination which you've already become familiar with. And it's very important that you should approach it with sensitivity. Here is a female pelvis, which is called the Ginny pelvis by its American makers. And I've got two of them here, one of which represents the normal pelvis, and the other one has got some abnormalities which I built into it. They come with a kit, and you can more or less make to order various sorts of pelvic pathology. And the only information I'm going to give you at the moment is that this one is normal and this one isn't. Now, when it comes to the actual examination of the pelvis, I think it would probably help if you come round, gather round a little more closely so that I can show you how to proceed. You've got to try and be as gentle as possible. You can imagine that this is a sensitive part of the anatomy, and you've got to be gentle. And when you're examining somebody internally, it's a good idea to look at her, not at the ceiling for inspiration or the wall or the nurse. People who experience pain tend to screw up their eyes. And if you notice her screwing up her eyes, then you know that what you're doing is uncomfortable. You don't have to wait for her to shout.
Potential to be so brutal.
You just sort of got it on like this, and you just have to. You're meant to enjoy it, just you can feel it more behind the cervix. No, let's go this one. It's normal. It's normal. Normal.
Thank you, Dr.
No, I know. This is the normal one. Definitely retrograde. Definitely abnormal.
Now, you have said definitely abnormal, and you're quite right. Yeah. Would you like to put a diagram on the board of what you think you were feeling? And then some of your colleagues can perhaps add to it afterwards.
Sorry. It's a retroverted uterine. That's what I found.
Now, you can all have a look and see what you've been feeling. And try and compare it with what you saw just now in the normal model. There is the uterus. There is a lump arising from the uterus on one side, and there's a lump on the other side. And there is a separate lump attached by a pedicle. All right?
That's a possible case.
Oh yes, this could be something that you could actually be feeling.
What, multiple lumps like that?
Yes.
Is the uterus lying in a normal position?
Yes.
You've got to drop these things on inspection, on palpation, on blah blah blah. You can imagine somebody's examining for a whole week and they're going to get pretty sick by the time they hear somebody say for the 150th time on inspection. Right? You've got to drop it out when you actually come to spieling the goods. Is psoriatic arthropathy usually progressive?
No, I think they get remissions and exacerbations and that.
But is there usually damage to the joints, permanent damage to the joints?
Yeah, I think so.
Usually?
Yes.
I don't know. I would assume not, because you sort of keep asking.
Well, the immediate finding on inspection is ecchymosis.
What's the difference between an ecchymosis and a bruise?
It's basically the same thing, I think.
Basically the same thing. Let's try and use good basic Anglo-Saxon terms.
Clinically, there's no jaundice.
Speak up.
There's no jaundice, and she's not clinically anemic.
What are you doing with your left hand at the moment?
My left hand?
Yes.
A little punch.
Nothing, basically.
Well, what's it doing resting on her tummy then?
Nothing.
Right, okay, well take it away. What about you? Are you able to palpate the liver? Can you feel the liver? Yes or
yes,
no?
I
You
think
can.
It's,
Where is it? How enlarged is it?
It's enlarged down to the umbilicus.
Down to the umbilicus, I see. Tell me what you're doing as you go along.
Yes, see if he's got clubbing in the hands.
I see, okay. Do you think a patient who got a toxic megacolon sufficient to cause an abdomen as swollen as that would be likely to be lying quietly in bed with you coming?
Well, I did say that not in this case.
Well, no, but you've got to apply yourself to the case in question, haven't you? Interested in people who have long lists in their mind to be regurgitated at every available moment. Okay, so carry on. Without going any further, why do you think it's gracefully distended?
I'd say possibly through to ascites.
Possibly.
Ascites, yeah. Cause I.
Sorry?
Yes, ascites.
You don't sound as though
you're
pretty sure of this.
I'm very sure. Ascites.
Are you? Well, you must say that with conviction, mustn't you? Just carry on.
Just gently palpating.
Why? Because it seemed like a good idea at the time.
You can see how tense the abdomen is.
I'd be surprised if it wasn't a bit tense. Do you think your belly was a bit tense?
Exactly. I thought, well, what possible credential did I have to be speaking at the Westminster Rugby Club dinner? It came to me. You didn't have to be famous in rugby. You could be famous for some other athletic pursuit. And I admit it. Yes, you're quite right. I was that man that supposedly raped all the girls, all the nurses in St. Lucia. Now, before you run away with the idea that that's actually true, I did my student elective in St. Lucia, and it occurred to me where I was staying in the nurses'
That is obviously a very abnormal metatarsophalangeal joint of the great toe.
Stay still, as gentle as possible. You can imagine that this is a sensitive...
Just cut up the costal cartilages and see what we find inside.
Inject it yourself with something, Carrie.
Come on, push. Come on, push. You're almost there. You're almost there.
That's
beautiful, beautiful.
Listen. What will you do if you make the parrot stilts?
Walk on the bloody things.